Depression, project by Hugo, Dmitry, and Ashley.
Our patient is a 37-year-old female. She presented to the clinic with suicidal ideation. She has a psychiatric background of depression, multiple personalities, PTSD, anxiety, outbursts of anger. Her medical history includes chronic tension headaches, benign intracranial hypertension, menorrhea, shoulder and foot sprain, and rotator cuff tendonitis, and kidney stones. Her surgical history includes a tibial ligation and brain surgery where a shunt was placed for relief of her intracranial pressure, eye, knee surgery, and an appendectomy. She is married with a teenage daughter and a stepson. She sells her body to get drugs. She has been arrested many times for issues related to drugs and prostitution. She has spent at least 6 months in jail during one of the arrests. Her health history includes benign intracranial hypertension, menorrhagia, ovarian cyst, pseudocerebri, kidney stones, herniated disc, depression, multiple personalities, PTSD, anxiety, and her surgeries include an appendectomy, a tubular ligation, a brain surgery where she had a shunt placement for her intracranial pressure, eye, and knee surgery. Physical exam. Health in general, she did have some weight loss, impaired peripheral vision and facial pain. Cardiovascular was all within defined limits. She did have an abnormal chest x-ray with a benign nodule found. She complained of constipation and abdominal pain in all 4 quadrants. She did have a kidney stone and had lateral pain below the ribs. She complained of joint pain, shoulder pain, and slight weakness. Bruises on her hand, shoulder, and under her chin were found, and a tattoo on her right leg. She is depressed and has anxiety. Lab and diagnostic test. Her weight is approximately 114 and her height is 5'6". Her blood pressure was 90/61, pulse 68, respirations 20, and temperature 97.1. A urinalysis was done on July 24, 2017, and the test revealed presence of white blood cells, red blood cells, and bacteria, so the results were abnormal. Hepatitis B test was non-reactive, and the urine drug test did not show any substances.
Medications. Acetaminophen was taken for mild pain and fever. Acetazolamide was taken for intracranial pressure. Aspirin, prophylaxis of blood clot prevention. Famotidine and pantoprazole was taken for GERD. Gabapentin taken for seizures caused by increased intracranial pressure. Magnesium hydroxide for constipation. Nicotine for smoking cessation. Olanzapine for psychosis. Potassium chloride, potassium insufficiency. And trazodone was taken for depression.
Depression, alteration in mood that is expressed by feelings of sadness, despair, and pessimism. There is a loss of interest in usual activities and somatic symptoms may be evident. Changes in appetite and sleep patterns are common. The underlying pathophysiology is not clearly understood and focuses on disturbances in the neurotransmitters of the central nervous system, serotonin, norepinephrine, and dopamine.
DSM-5 criteria for depressive disorder. The depression diagnosis was not specified in the chart due to secondary conditions that could cause depressive symptoms. Patient's depression could be caused by crack abuse. Furthermore, decreased appetite could be related to the abdominal pain and of unknown etiology. The patient could have met DSM-5 criteria for major depressive disorder if the symptoms, abuse, and GI problems were not causing symptoms of depression. History assessment and medical health assessment revealed 6 symptoms of depression: depressed mood most of the day, insomnia, easily agitated, recurrent suicidal ideation without a specific plan, decreased appetite, and inability to concentrate. Analysis of data presented. The patient was only 37 years old, but appeared older than stated age. This could be attributed to the lifestyle she currently maintains. She is addicted to drugs and managed to get them when her body craves for them. For many years, she exchanged her body for the drugs and had been arrested many times. She used following substances: crack, methamphetamine, marijuana, and opiate. She is a smoker and smokes 25 packs per year. With this type of lifestyle, she was predisposed to acquiring many diseases. Nevertheless, hepatitis B test showed a negative result. The psychiatric history of depression, anxiety, PTSD, anger, and addiction predisposes her for self-harm. Depression affects every aspect of someone's life, and when severe, can lead to suicide. Suicide risk assessment was conducted, but she denied having any thoughts of self-directed or other-directed violence at the period of assessment. Her body weight of 140 pounds, small for her age and height. Ideally body weight was 117 to 143 pounds. She appeared malnourished. Her blood pressure was low, but can be normal for her, as verbalized by the patient. There were signs of weakness and lack of energy, which can be due to not having enough nutrition to support bodily functions. She performed well on the mini mental status examination and MOCA test. She did not have significant problems with cognitive abilities, but continued abuse of drugs. She may develop continued issues later in life. She was pleasant and engaged in interactions with other patients. She was approachable, but displayed a decreased mood. She was oriented to person, place, time, and situation. She was open about her life and willing to make changes so she can be with her family.
Plans of action. Goal. The patient will verbalize increased mood and ability to perform social and occupational activities. The goal should be met by August 5th, 2017. Interventions for the plan of action. Teach her to be aware of behaviors that would improve her well-being, such as eating balanced meal and engaging in exercise. Teach her the importance of adhering to medications in order to live a productive life. Teach her how to recognize the signs and symptoms of depression and seek help. Some signs and symptoms of depression would be for emotional, feelings of tiredness, sadness, emptiness, and numbness; behavioral, irritability, inability to concentrate, difficulty making decisions, loss of sexual desire, crying, sleep disturbance, and social withdrawal; and physical, loss of appetite, weight loss, constipation, headache, and dizziness. So we will provide her with resources available in her community, encourage her to engage in social interaction with family and friends, encourage her to adopt positive coping mechanisms, and teach her the effects of substance abuse and the impact it has on life, such as risk for nutritional problems and increased isolation from others. Evaluation for the plan of action. The goal was met and the patient verbalized increased mood and ability to perform social and occupational activities. The goal was met by August 5th, 2017.